That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hello, everybody. Welcome back. This is Real Health with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor. Brandi Rashidian is my other half and the talent and the reason you all watch the show, I know.
We come up with new titles every week.
I'm running out. After 30-some episodes, I'm running out.
Well, and I can't hold Master of the Universe. That's already taken, so.
He-Man. That was He-Man. He-Man. She-Ra. What was her title?
I'm not sure.
Mistress of the Universe. That doesn't sound good.
Yeah,
okay.
We'll just leave that one alone.
Well, we've got a lot to talk about today, but just so you know, in case this is the first time you're joining us, Real Health is the podcast where we read the latest news articles regarding health, and then we will summarize it and discuss it, and we'll talk to you about how it should affect your life, whether it has already affected your life, and what to do about it. And our purpose, our goal for you is that you will always feel better, get stronger, live longer, and feel younger. And so based on that, we have a lot to talk about.
Yeah, I hope we can get through
today.
everything.
I think our last one was on Valentine's Day, right? Wasn't it?
Yeah, that was fun.
So, and we still didn't decorate, and we still won't. So we'll figure it out eventually.
It's not Valentine's.
We have our book, we have our mugs, we have our coffee. Let's jump
roll.
right in. We have a lot of articles. We're going to talk a little about chiropractic and back surgery, and we're going to talk about Elon Musk's new chip that was actually implanted in a human being. We're going to talk about that.
Crazy.
And then follow up on that is they actually figured out how to 3D print brain tissue, and the brain tissue actually talks to itself. It's very cool.
Yeah.
I don't know what language it speaks, but it talks to itself. Then we'll talk about, I don't think we'll have time for these two, but this is a couple of diseases that and issues that young people or younger than expected people are suffering from. So we'll talk about that and preventing those as well. So coming back to this one, this is from Epoch Health. It's called Your Health Matters. And the title of the article says, Chiropractic care may reduce need for future back surgeries. A new study shows that chiropractic treatments may significantly lower the risk of repeat lumbar surgeries post-discectomy. So a discectomy is when surgically a disc is removed from the lower back, so or partial part of the disc, or the part of this that's bulging, or the part of this that's herniated. And believe it or not, there's a big difference that most doctors don't even know, that there is a difference in a disc bulge versus a herniation. And herniation can actually come in three forms of a protrusion, extrusion, and sequestration. So this is a complex matter. But anyways, what they're saying is that most people who have back surgery, there's a chance that they'll have to have a second back surgery later on. But those who have the back surgery and then they get chiropractic care after surgery, their chances of having a repeat surgery are about half.
Oh yeah, we've seen it in our own patients. Your aunt years ago fell and broke her back. She had to have a fusion.
Yeah, they fused 3 segments.
And she, as soon as, she was out of rehab, she was under chiropractic care, and she's been coming every week.
Her neurosurgeon and the physical therapist who did her rehab both said that you'll probably not be able to work anymore. Mm-hmm. She's a hairdresser. She used to be a nurse. Mm-hmm. And also they said that eventually you'll end up in a wheelchair.
Correct.
And now that was, 20 years ago?
No, it hasn't been that long, but it's been a while. We had kids.
It's been at least 15 years, right? Because we were in the other location at the time. Either way, but she's still walking, doing well, 70 some years old.
She's doing awesome.
Healthy and happy.
Matter of fact, she had somebody at the same time who had almost identical surgery by the same surgeon. They were actually in rehab together, and that she saw her surgeon and during the follow-up said, there are others that had surgery at the same time. You know who they are. They are not where you are. So what did you do different?
That's right.
And so, she has her surgeons asking her, what did you do different? Because this is not what we normally see.
Yeah. Now, if you have had back surgery and you do go to a chiropractor, make sure that chiropractor is trained and qualified to treat people who have had surgery.
Right.
You can't treat them exactly the same as people who haven't had back surgery. So the rest of the article: every year, 500,000 Americans find themselves on the operating table for lumbar discectomies to combat debilitating lower back pain caused by herniated discs. Yet this path to relief isn't always straightforward. Up to 14% of patients find themselves needing additional surgery, underscoring the complexities of effectively treating persistent back pain. However, hope emerges from the University Hospital's Cleveland Medical Center, where recent research indicates that chiropractic care could significantly reduce the rates of secondary surgeries. Published in BMC Musculoskeletal Disorders, and BMC stands for Biomed Central. The study casts a new light on the potential of spinal manipulative therapy. We like to call that adjustments, spinal adjustment, because manipulation is non-specific and adjustment is specific.
Yeah.
That's a preference on our style of chiropractic. And so in the aftercare of lumbar discectomy, led by chiropractic physician Robert J. Traeger, the research delved into the experiences of adults grappling with ongoing sciatica, a form of pain radiating along the sciatic nerve post-surgery. Over a 2-year observation period, the study compared the outcomes of patients receiving adjustments with those under standard medical care. It found chiropractic intervention could significantly reduce the need for further surgical interventions.
I would like to point out, although, because there's going to be tons of people, right, in this world that say, well, that research was led by a chiropractor. 100%. You wouldn't have a neurosurgeon leading a chiropractic research. However, let's also not miss the fact that this was actually performed at Cleveland Medical Center. Okay, so this is a major medical establishment, very well known, very reputable,
and
who's supporting and running
the article
this.
is published in a United Kingdom publication.
Right.
So and chiropractic's bigger in the U.S. than in United Kingdom. So although they have chiropractors there, it is mainly medically driven. So the study explored health records spanning 2 decades from 2003 to 2023. That's not a short period of time, 20 years. The researchers effectively created 2 comparable groups for their analysis. One group had received chiropractic care while the other underwent usual medical care without chiropractic care. The eye-opening results. Patients in the chiropractic group showed a 45% less likelihood of needing another lumbar surgery than those in the standard care group. Notably, only 7% of patients undergoing chiropractic care required a second operation compared to 13% in the control group. The thing is, the wild card in all of this is who was the chiropractor and what technique did he use? Because chiropractic is like medicine. You go, oh, a medical doctor treated this person. Well, what's their specialty? Because chiropractic has lots of specialties. We in our office, we have our own style, our own technique that we have developed over the past 24 years that seems to be very, very effective. We have specialties in pediatrics, specialties in post-operation chiropractic care for people who've had surgeries and so on. So who knows? I wonder if this number would have been much higher if someone like our office had been seeing these people.
Well, I think it would be fascinating.
Obviously, I'm biased.
It would be fascinating, though, to take multiple offices who have and take that history of all of their post-surgical patients and see what those outcomes would be in comparison.
Because a true study would say, okay, this was done with this type of chiropractic adjustment.
Correct.
Did they use decompression? Did they use flexion distraction? Did they use side posture manual adjustments versus drop table versus activator?
Correct.
There's so many techniques.
Did they make their determinations based on x-ray or based on palpation?
Exactly. But it sounds like the pool is pretty big, and if this is
those are great results considering it's a limited and there's some unknowns. But even at that, for something we would look at
it's
more
basically
generalized.
You can go to any chiropractor and your odds of having to have a second surgery are half.
Right. Which is quite impressive.
That's not bad at all. So the study suggests that chiropractic care may be a valuable addition to post-surgical treatment plans. Its potential to reduce the need for another back surgery could alleviate the physical and emotional burden on patients and imply significant healthcare cost savings as alluded in the study. Unlike standard post-discectomy treatments focusing mainly on pain relief and rehabilitation, chiropractic care adopts a holistic method to improve the body's natural healing and spinal function. I really enjoy that. I mean, of course,
Yeah.
they say spinal manipulation. I say chiropractic adjustment. They are different things.
Well, why don't we dive? Because I think one thing that this does not talk about is why a chiropractic adjustment post, surgery, whether it be a discectomy or, some type of spinal fusion. Let's dive into that just a little bit. Why would that be beneficial for someone if they've had, spinal surgery? You still have spine typically above and below whatever was either removed or
Yeah.
fused. So why would we even do that? Why
Well,
would we
that's the
touch
thing.
that?
A lot of times, the discectomy is accompanied by something like a hemilaminectomy or a laminectomy, which is part of the procedure. And then, like you said, there's instrumentation that can be implanted, which is hardware, which is fuses the segments together. Fusion immobilizes that segment, so the segments above and below have to have more stress on them. Partly because, and part of the reason they need another surgery is because the segment above and below now has more stress on it, and that's the next disc that gets affected. And and the surgeon will always tell you that.
And a lot of times people go into surgery without proper alignment to begin with.
Yeah.
So they're trying to fix one segment, but not
Right.
taking into account the
Yeah.
segments above and
So,
below.
so just so you know, a disc bulge is always, etiologically speaking, etiology means cause. The cause of a disc bulge is always degeneration. So why would a disc degenerate? Let's say L5 degenerates, but L4 is perfectly healthy. Why would one degenerate over the other? Now, the doctor will usually say it's because you're getting old. Well, I got all of my discs in all my entire spine from the same place at the same time.
Right.
Why is that one aging and not the others? It can't be age. It can't be age.
We would
Otherwise,
ask that same thing about a car. If you bought 4 tires at the same time and one of them is wearing or two of them are wearing,
yeah.
right, and the others aren't at the
Right.
same rate, then we would say why that would make complete sense to us,
It
right?
would be alignment. It would say your car is out of alignment. The same thing with the spine. If the spine's out of alignment, one disc will wear out faster than the others. And then that leads to a bulge. Bulge is degenerative. More disc bulges end up in surgery than herniations. Herniations actually can repair themselves because they're so severe. Herniation means the part of the disc tears and the inside nucleus pulposus actually herniates out. That's why herniations are always directional, which means it'll be to the right, to the left, to the back, to the front. It's directional. Bulge is not directional. Bulge is like an ice cream sandwich that you squeeze together and the ice cream bulges out the sides. Very different cause, very different treatment program and protocol. And then the types of herniation, if it doesn't tear all the way through, that's a protrusion. If it tears through but doesn't leak down to other levels, that's called an extrusion. And then a sequestered disc is when part of the nucleus pulposus, the center of the disc, leaks out. It's like a jelly part of a jelly donut, leaks out and then drops down and it starts to affect other nerves in the body. And so those can all be extremely painful. Those are all trauma related. So if it's a bulge, it's not trauma. Now, you can have a herniation on top of a bulge, which gets even more complicated, but you got to go to a chiropractor who knows how to treat that. And I wonder if they got some of this alignment done before the surgery, that would even reduce the odds of a second surgery more, because you can't just tear the disc off, not correct the cause of that disc issue, and
Correct.
expect it to be okay. That's another reason people need second surgeries. But I liked how he said chiropractic is a holistic method to improve the body's natural healing and spinal function. See, that sounds like heresy to some people. Go, natural healing? What are you telling me? My body can heal itself? Absolutely, yes, it
All the
can
time.
heal itself. You know what happens with
Matter of
this?
fact, we don't even question it most of the
Yeah.
time,
You
right?
ask any human physiologist, let's say, or anyone who, or a pathologist of some sort, who really understands the human body, they'll tell you when a disc herniates, your immune system goes to work. And in fact, certain types of white blood cells, like phagocytes, will attack the herniated disc and eat it
That's crazy.
to remove that. And then scar tissue forms where the tear was in the annulus fibrosus of the disc and seals it with scar tissue and actually repairs itself. Herniated disc even can repair itself. That's why the bulge is much more complicated because it's degenerative over time. But the herniation, the body knows how to heal. It's just like when you get a cut on your hand. You know, you may need stitches, and I'm not saying you don't get the stitches because your body self-heals. But what do stitches do? They don't heal your body. They
just
pull
keep
the
it
skin together. They stop the bleeding. They hold the skin together while the body heals itself. A broken bone, same thing. You may have to immobilize it, but then it heals on its own. The body does have natural healing abilities, and chiropractic is based on the fact that the body can heal itself. So let's remove anything that interferes with that healing process, like misalignments, like nerve interference.
Right, because what we're really talking about is messages, right?
Yeah.
So if the brain is in control of everything and the brain is telling the different muscle tissue, cell, whatever it is that is not functioning right or has been injured or whatever the case may be, the brain has to say, here's how you need to repair. Here's how that process is done. Let me give you the framework for that. But when that framework, when that message can't be given or received properly, that's when that healing gets interrupted. So
there's a quote by another chiropractor. Chiropractic is about more than just addressing the immediate pain. It's about realigning the spine to promote long-term health and prevent future issues. This is Dr. Michael Summers, a seasoned chiropractic physician that told Epoch Times. Now, Epoch Times is just so you know, it's a far right international newspaper. I don't know if that has, what politics have to do with it. But what I found very, very interesting is in this article, they called all the chiropractors chiropractic physician, but never put the title of doctor in front of them. But when they talk about a medical doctor, they did put the title doctor in front of them, which I think tells me that they are a bit biased. The potential of spinal adjustment in reducing repeat surgeries lies in its ability to improve spinal alignment and mobility, thus addressing the root causes of spinal issues. By correcting spinal alignment, we can alleviate conditions that might lead to further surgeries, such as recurrent disc herniation. And it says Mr. Summers says, and he's a chiropractor. They just said chiropractic physician earlier, but they won't call him doctor. We will call him Dr. Summers. If you're listening, you are a doctor. You should be credited as that. Through chiropractic care, we're not just treating symptoms. We're fostering an environment for the body to heal and function optimally. Very well said, Dr. Summers.
thank you very much.
Spinal surgeons weigh in. So this is a spinal surgeon. This guy they refer to as Dr. Antonio Webb, and he has earned it as well. I'm not saying he's not a doctor. He absolutely is, and we respect you very much, Dr. Webb. A respected spinal surgeon discusses the evolving views on chiropractic care with the Epoch Times. Reflecting on his training, Dr. Webb notes, "We send patients to physical therapy, but I can't think of one time in my training that we sent a patient to a chiropractor. However, this perspective changed with his professional experience. When I got out into practice, I wanted to explore other options for my patients, so I visited a few chiropractors myself. Now I commonly refer to chiropractors."
I mean, we've heard that time and time again when other physicians come in to see us. Some maybe with the background and understanding what we do and who we are, and some with none. They were referred in, or they're like, I'll just give it a shot. And I don't think we've had one that's left going, this is exactly as I thought. Most of them are blown away, surprised, and it finally makes complete sense to them.
Yeah. If you hear a doctor, any specialist say anything negative about chiropractic, just ask them, how many chiropractors have you been to, and how many adjustments have you had? And if they say, "Oh, I've never been," well, there's no credibility there. If they say, "I know all I need to know," again, there's no credibility because the chiropractor trains for many years and takes many tests and goes through many board exams just to become a chiropractor. And so how could they possibly know? It's like me saying I know about everything there is to know about dentistry,
Right.
or everything there is to know about vascular surgery. I don't, and I don't claim to know that. And then if a medical doctor says I went to one and I didn't like it, Well, maybe they went to a terrible one.
Yeah.
There are bad
There
medical
are.
doctors, there's bad surgeons, there's bad dentists,
Yeah.
there's bad physical therapists, and there's a lot of good ones out there too. We regularly refer to physical therapists as well for many conditions, but you have to understand chiropractic. The first federally funded study on chiropractic showed that it boosts your immune system. I wrote about it in the book. I know for a fact that chiropractic will increase your strength and your energy levels. It promotes symmetry throughout your body. Not only will you feel better, but you will look better because you'll have better posture. I know that there's mental clarity that improves when you have chiropractic care. We just had a patient who said, emotionally, I've never felt better after my first adjustment. Not physically, she felt better physically too, but she said emotionally.
Yeah.
Mental
huge.
clarity. A functional MRI study was done where they had people wiggle their toes, and they on their functional MRI, they saw how many brain centers light up. Then they corrected spinal misalignment and had them wiggle their toes, and only one brain center lit up. That means the brain becomes more efficient after a chiropractic adjustment. We know for a fact you'll even have better peace of mind when you have better alignment because you are less susceptible to illness and injury. You're not going to be one of those people who has a bad back that constantly goes out. You'll stabilize and strengthen that spine so it can withhold the stress of your life.
Absolutely.
And you know what? Faster recovery. People who go under chiropractic recover from injuries much
100%.
faster, especially if they've had chiropractic before that injury. We've had patients who've been under chiropractic with us for decades, and they'll fall down the stairs, and then they'll come in and go, I fell down the stairs, I injured myself, but they get better within a week or two as opposed to something that would have taken 6 to 8 weeks to
Absolutely.
get better. We've seen people reduce anxiety and depression after chiropractic care. We know for a fact that there's a system in the body called the brain-body reward cascade. The brain receives information from the body that reward the brain. Pleasure centers light up in your brain, and when there's misalignments, that doesn't happen. Everything is dim. A sunset or a sunrise doesn't look as beautiful. Hugging a baby doesn't feel as good because of those spinal misalignments. What else can I tell you? You know what? It's fast, it's easy, it's affordable. It should be your first line of defense, and you need to be going to a chiropractor even if you don't have any
And there's no
injuries.
negative side effects.
Well, an erect posture.
Yeah,
And in fact, if an erect posture lasts longer than 4 hours, no need to call anybody.
that's right. Moving on, Elon Musk. Boy, this guy has some really fun stuff going on, doesn't he?
Oh my gosh. And he is so scrutinized by so many people.
Yeah.
He's not a liked person, although he has made a difference in the world.
Yeah, he's doing some pretty amazing things.
So anyways, and you don't have to agree with everything he does. This is from NBC News. Behind Elon Musk's brain chip, decades of research and lofty ambitions to meld minds with computers. It wasn't the first tiny device to be implanted in a human brain. Still, Elon Musk's announcement on Monday turned heads in the small community of scientists who have spent decades working to treat certain disabilities and conditions by tapping directly into the body's nervous system. Musk's announcement was sudden and offered little information beyond the news itself. And this is in quotations. The first human received an implant from Neuralink yesterday and is recovering well. Initial results show promising neuron spike detection.
I just want to know more. I'm so frustrated that we don't have any information on this patient.
I think there's some learning that has to take place, and so it's a long-term process. But he said Neuralink's new milestone is jumpstarting an industry that has already undergone rapid advancement in the last 15 years. The first brain-computer interface was implanted into a human in the late 1990s. Research that was led by a pioneering neurologist named Phil Kennedy. In 2004, a tiny device known as the Utah Array was implanted in a human for the first time, allowing a paralyzed man to control a computer cursor with his neural impulses. How cool is that? That means you think and the mouse moves, and you think and it clicks on something. It looks like a small chip with thin spikes that are actually dozens of tiny electrodes. The array is designed to attach to the skull through an opening in the skin. So this
That
is not
feels so
internal.
sci-fi.
It sticks on top. Yeah. Using the Utah Array, scientists have been able to demonstrate how Brain-computer interfaces can help people control a robotic arm with their mind, stimulate their own muscles and limbs, use computers and other external devices, and even decode handwriting and speech.
See, I think this is so cool. This to me is what medicine is about. It's about finding these ways to, for someone to have lost, a limb and to be able to have the same functionality, through the
Yeah.
wiring of the brain is just unbelievable. It seems not even possible, right? Like I remember watching movies as a kid with this kind of technology, and it seemed like it would never ever happen, right? And here we are, and we're there.
I mean, the original Star Trek from the 1950s and 60s,
Yeah.
they had the little thing, the
Yeah.
flip phones that they would talk to people, and then now that's old technology.
So fun.
The Neuralink has been developing a brain implant that would allow people, such as patients with severe paralysis, to control a computer phone or other external device using their thoughts. But this one is fully implantable, not like the Utah array. Neuralink also uses innovative robotic surgery rather than a specialized surgeon to implant the device. So surgeons aren't doing this
I
implantation.
know, which I
Robots are.
I honestly would prefer. I know that sounds terrible, but you're not going to have as many mistakes.
Yeah, you're not like, I hope the robot got a good night of sleep last night.
Right. I hope he didn't have a drink or two.
Yeah.
Yeah, I don't
I
want
hope
somebody.
he's not mad at his wife today,
Yeah,
or
seriously.
her husband, or automating the procedure with a robot could make it more efficient, effective down the road. This is in quotations. He said you can put more of them in, you can put them in quickly, you can avoid blood vessels. You have to show that the robot is safe. So they won't be able to trust that the robot is safe. Musk said the patient is recovering well. Initial, and we read this already. There's promising neuron spike detection. It didn't really go into details. It's difficult to know what that means. He also said the early clinical trials will aim to treat people with paralysis or paraplegia. Brain-computer interfaces can make a huge impact, including for stroke survivors
Yeah.
and patients with spinal cord injury, paralysis, and ALS, which was Lou Gehrig's disease, very debilitating disease. Beyond clinical applications, it's easy for the imagination to run wild with sci-fi notions of bioengineering. Musk himself has stoked those fantasies, saying in 2022 that he plans to get one of Neuralink's implants someday. He wants to put one in his own brain.
Well, I know. And because they never said anything about who the patient was, my very first thought was he did it. Right? And he's not going to say anything until he knows it's all gone well.
Right.
But that was speculation on my part.
Many
That's not
many
confirmed.
scientists, however, think that kind of thinking is too far off in the distant future and not very practical. And they also said that they talked about funding at the end of the article and saying that, commercial companies are putting a lot of funding into this, which allows the research to go forward faster because universities who were originally doing these research, they discover things, but then they don't have the funding from the research grants.
Right.
They're never enough to, really take it to the next level. And Elon Musk, with the billions of dollars that he has.
Well, yeah, and the private sector can take and they have people who will fund those things, right? It's never going to be done to the extent that it needs to be in the private.
Personally, I'm on the fence. I don't know if I would get one or not.
I mean, if we're talking quality of life, if you had ALS and it was about your remaining years being able to connect and communicate, I'm fairly certain that would be a high possibility.
Right. As long as someone else can't control me also.
I could control you. Oh, sorry. Okay.
Like a puppet.
I'm like, this has other implications. That could be fun.
It'll be a device like this. You remember those old dolls, the voodoo dolls? You stick a pin in it, but you'll do it through your phone. You'll be like, you'll push a button. I'll go, ow!
That's great. Okay.
So let's do one more in a couple minutes. Scientists produce first 3D printed brain tissue for use in research. So I thought this goes kind of hand in hand with
sure
the
does.
chip implant. Scientists say they've created the first 3D printed brain tissue where neurons network and talk to each other.
That's amazing.
This could be a hugely powerful model to help us understand how brain cells and parts of the brain communicate in humans. Researchers already have an organic model for brain research called brain organoids, but organoids grow with much less cellular organization and interconnective ability than the new 3D printed tissue. It says this is Dr. Zhang said, we printed the cerebral cortex and the striatum, and what we found was quite striking. Even when we printed different cells belonging to different parts of the brain, they were still able to talk to each other in a very special and specific way. So these cells are just communicating with each other. Neurons just find each other and communicate, which is very neat.
It's very neat.
Reporting February 1st in the journal Cell Stem Cell. It's a funny name. Their 3D printing technology has improved on prior attempts to create 3D printed brain tissue. The Madison Lab's tissues include neurons created from stem cells, and they are oriented in a different pattern than was used in prior attempts. The tissue still has enough structure to hold together, but it is soft enough to allow the neurons to grow into each other and start talking to each other. Brain cells in the new tissue use neurotransmitter chemicals to send signals to each other. They can even form neural networks, as is seen in living brains.
It's wild.
Our lab is very special in that we are able to produce pretty much any type of neurons at any time. Then we can piece them together at almost any time in whatever way we like. Because we can print the tissue by design, we can have a defined system to look at how our human brain network operates. We can look very specifically at how the nerve cells talk to each other under certain conditions because we can print exactly what we want. The Madison crew believe their new 3D printed tissue could be easily used by most research labs. It does not require special equipment, and scientists can investigate neurological processes using standard microscopes. Potential applications include studies into Down syndrome, Alzheimer's disease, brain development, and the creation of experimental drugs, the researchers said. And one more quote here. In the past, we have often looked at one thing at a time, which means we often miss some critical components. This is so important. I love the way they say this. Our brain operates in networks. We want to print brain tissue this way because cells do not operate by themselves. They talk to each other. This is how our brain works, and it has to be studied all together like this to truly understand it. And I go, why is it just the brain that works all together? Do you know every cell in your body works together with all the other cells in your body? But what do? We put a box around the liver and only look at the liver. We put a box around the pancreas. We put a box around the spleen, and we only look at it separate. It's not a separate individual. All of these have to work together.
It's a symphony. If we look at it as a symphony and you have all the different parts, right? You have the string instruments and you have the percussion and you have, our body is the same way, but all of them communicate, work in conjunction with each other to create this amazing music, right? That's our body. That's the perfect analogy and how things communicate.
It's amazing. I'm glad they're realizing that. Hopefully they will realize it, because this, again, is one of those chiropractic concepts that you never look at one thing by itself.
Correct.
You never look at that L5 disc and not worry about the alignment of the pelvis below it and the alignment of the atlas above it and everything else. So that's been chiropractic, and then we apply that to the entire body. This arm needs the other arm to be working properly.
Right.
The lungs, the heart, all of that have to cooperate with each other to keep you alive. So you should never isolate one and just look at that.
Well, I think about like bodybuilding, right? Remember how when you have an injury and you can't work the same load on one side of the body than the other, but you still have growth.
Correct.
in muscles on
Absolutely.
the opposite side of the body that you're working.
Absolutely. Yeah, you can actually, that's why shot putters who throw a heavy ball with one arm don't have one big shoulder, one skinny shoulder.
Right.
That's why tennis players who hold a tennis racket with their dominant arm don't have a big forearm and a skinny forearm.
Right.
Because the body wants to stay symmetric. And neurologically, it's called a neurologic crossover. You make this arm stronger, that one gets 35% stronger even if you never train it.
That's amazing.
Very, very neat. Very neat. And you know, it also reminds me of the scene from Young Frankenstein. Have you seen that movie?
It's been years.
Well, he sends Igor to go get a brain, and he tells him specifically what brain to get, and he breaks the jar because they need a brain for the monster. So the jar drops and breaks. So he picks up another one, and Frankenstein goes, "What brain did you bring?" He goes, "I don't know. Her name was Abby. Abby Normal." It turns out he brought an abnormal brain, which is why the monster was such a beast. Anyways, so now they can print Frankenstein's brain, and they won't have to get abnormal brains. I hope you enjoyed this. We didn't get to the other two, but we will. I think we should talk about those as far as the diseases of that are killing people younger these days, like cancer and stroke. There was an 18-year-old who had a stroke. We'll talk about her story. And a country music singer, Toby Keith, passed away recently at the age of 62 because of stomach cancer, and that shouldn't have affected him till later on, like age 68. So we'll talk about his story and how to prevent some of these things. And then we have a ton of other articles as well. We appreciate you.
Yeah.
Thanks for joining us.
Thanks for tuning in.
We always enjoy your comments. We're always grateful that you join us. And if you share or like our video, that will help us keep going.
Yeah, and if you run across an article you want us to go through, send it over. We'll take a look at it.
Absolutely.
Awesome. Have a great week.
God bless.